Fractures or broken bones can have a lot of long-term issues like pain, stiffness, weakness, and slow or poor healing. But on top of those concerns, which fractures are likely to lead to arthritis? I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injury. This is part of my Ask the Doctor video series based on questions that you leave in the comments to my videos. And this one really encompasses a number of different questions I get about different types of fractures and what's the risk for arthritis down the road. So many broken bones, so many fractures don't lead to a risk of arthritis, especially if it's the tibia in the mid part of the tibia, the shin bone, or maybe bones in the forearm or bones of the upper arm. Those don't. The ones you have to worry about are the fractures that go up into a joint. So a good example of that would be the tibial plateau. This is the knee, and the tibia, the long part of the shin bone, again, wouldn't have that risk. But if it's a tibial plateau fracture, where the fracture goes up into the joint, very often would be one that likely turns into arthritis. Same thing would go of the tibia down at the ankle. Again, not so much up here at the shaft, but down into the ankle joint. And that risk can certainly be minimized by surgery that lines that bone up perfectly and uses a plate and screws to hold it in place in the proper position while it heals, but it doesn't completely eliminate that risk. We know that even well-reduced and fixed, say, tibial plateau fractures or tibial plafond, or what some people call pilon fractures, they have a higher risk of arthritis, post-traumatic arthritis, than fractures that don't involve those joints or people that haven't had that fracture. So if you have a fracture that goes into the joint, again, shoulder, elbow, wrist, knee, ankle, those would be ones that you would want to see an orthopedic surgeon right away, get it lined up perfectly, usually surgically held in place with plates and screws, and minimize the risk of future post-traumatic arthritis. Now, if you have an orthopedic injury and you want to hear about options other than surgery or other than cortisone shots, click the link in the description below, fill out the contact form. You can learn more about potentially seeing me as a patient and potentially scheduling an appointment to see me. Also, I'd love to hear your experience with your fracture, whatever part of the body it is. Leave those in the comments below this video. Just understand, if you leave a question in the comments, I can't respond and give you medical advice. But what I can do is answer your question in a future video, like what I'm doing here. Make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start my next live stream, including my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.